Initially, the partnerships we started were for product trials and testing, and also to get feedback from the targeted beneficiaries on whether these products actually work for them to end identification. Over the years, we've had global partnerships, like the one we have with UNICEF. We have also local partnerships with implementing organizations, non-governmental organizations, but from where we sit, our biggest partner has always been the government, ministries of health, ministries of water and sanitation, depending on the country. Currently, we have so many partnerships globally. If I may be specific to Africa, we are working with the organizations like our biggest partner is UNICEF, obviously, because UNICEF is the custodian of Sustainable Development Goal number 6. And they have also really helped us get the products to the eventual beneficiaries because of the support from getting the product from us to training communities on hygiene and sanitation. We work with organizations like WaterAid, for example. We work with Water for People. We work with Plan International. We work with them to end open defecation through CLTS, which is Community-Led Total Sanitation. We have organizations that work with children as well, and those are like World Vision, who also we work with them, for example, in Uganda. The partnerships we are currently working on actually is to get more private sector partners on board. We've had many private sector partners who have corporate social responsibility budgets coming to us, trying to address the issue of open defecation across Africa. And that is what really is part of our strategy right now, to bring on board more private sector partners to support the upgrade of latrines, construction of latrines. Right now, we're also looking at organizations that can support us upgrade latrines for schools, because the school is a very good entry point for sanitation impact in communities. So, and then we always partner with the organizations that also do R&D, research and development, and give us feedback on the same. We've had many organizations from Japan supporting SATO to get the products to organizations like UNICEF, WaterAid, Water for People, World Vision. We have BRAC, which has been a very good partner for us in Uganda and here in Kenya as well, and in Asia as well. But specifically, over the years since 2014, we've evolved our engagements. We've also had research institutions. London School of Tropical Medicine and Hygiene has been one of our partners as well. We have Nyumbani Choo campaign, which brought on in Tanzania, which brought on board several NGOs and private sector partners. And currently, we over the last 8 years, we've had partners ranging from public sector partners, private sector partners, and even social foundations, the foundations from global. The biggest partner when we started was Bill and Melinda Gates Foundation, who financed the initial the initial SATO products, testing and trials. And from then on, we've continued to develop our partnership strategy to bring on board mainly organizations that provide us with feedback to continuously improve our solutions, our product offering. We always strive to look at our products as a solution rather than a product in itself. We look at the value the product brings, and we are continuously evolving through feedback and through engagement with these partners. If it wasn't for our partners, we wouldn't be where we are. Our vision is to reach 100 million people by 2025. That's the SATO mission. And so far, we've reached 35 million people globally, with approximately 7 million in Africa alone. The thing with public health programs is that it is like an interconnected web of partners that drive the impact. So we cannot claim solely that we've changed the lives of these people without the partners we've had. So we've had partners who've helped us with issues to do with regulatory issues around clearing the products from the port. We've had partners who've helped us with the supply chain, making sure the product reach the eventual beneficiaries. We've also had partners addressing the challenge of trainings, for example. We've also had partners supporting us in even social marketing. We have NGOs like BRAC, We've had organizations like Water for People who do a lot of social marketing to teach people the value of upgrading toilets, the value of investing in sanitation and hygiene. We have different strengths as partners. We always try to look at what value the partners bring before we even engage that partner. Currently, what we are working on is to bring on board financial partners, which has become a challenge to us, but we are still getting so many positive feedback from some of the financial institutions on what we are trying to do. Because if you look at the beneficiaries we are targeting with our sanitation and hygiene solutions, many of them live under $1 a day, and they need financing for them to actually, even if they see the value, they still need that financing. So there are several challenges the partners have addressed. And in summary, I can say number one is logistical, the challenges that partners have come on board. We are in discussion with organizations that are doing e-commerce, for example, to make sure that they support us in bringing the product to the last mile. We have partners who help us with taxation issues when we are getting products into countries with very, very stringent taxation and import issues on the product. And then we've also had partners who have very strong strength in trainings, especially bringing people together like masons. We have partners, like I mentioned, the governments. We are working in the countries we are working in, training community health volunteers and community health workers on sanitation and hygiene. We've also had partners who support us also in the social marketing aspect. So through advertisements, trainings, so sanitation campaigns. We also had partners doing puppetry to teach children on hand washing, for example. So many challenges that we have faced have actually been addressed, some of them by engaging those partners and having those formal partnerships. We've had partners who helped us with product trials as well and feedback from the eventual beneficiaries. We are not as big as many organizations in Africa here. So in countries, like I mentioned, in countries where we have gotten into, some of them we've actually had a very huge support from the partners to get into those countries. Even if SATO is not like present with a manufacturing plant in those countries, yes. I forgot to mention one of our biggest partners as well, and I want to recognize them in this as well. They are our manufacturers who've been really helping us and working tirelessly to make sure that they produce the product in the quality that we demand and the product and the beneficiaries demand, and also making sure that there's product availability on time and when it is needed. In Africa alone, we reached a milestone in 2020 of shipping 1 million units through those partnerships. We are continuously innovating. There are certain products that are still in the pipeline with our research and development department, which are also being tested through partners like PSI, for example, has been a very big partner, Population Services International. They have been very big partners for us in testing and piloting these new products and giving us quality feedback that we use also to improve this product. We've now reached over 500 schools globally through these upgrades, toilet upgrades for schools. And we just last year came up with a very new, nice strategy called the School Toilet Enhancement Program within SATO, which is calling upon many private sector partners with corporate social responsibility budgets to support upgrade of school latrines, especially for girls. If you look at the latest report from UNICEF and World Health Organization on the status of water sanitation and hygiene, it is telling us that we have to double our efforts if we are to reach those targets stipulated in the Sustainable Development Goals. The current interventions are not going to achieve those targets unless more partners come on board. And this is why SATO is very keen, SATO and LICSIL are very keen on bringing on board many partners. We are grateful to the current partners we have. They've done an amazing job with us, but we are calling on more to come. We have an open door policy here to listen and see whatever they can contribute, be it on technical support, time of their employees to maybe mentor some of the sanitation entrepreneurs, but more importantly, build latrines. That I think that is what will eventually end open defecation if we invest in constructing of those latrines. A lot of the efforts that has been made so far in getting our solutions to the beneficiaries has always been driven by non-governmental organizations, and we've only reached so few. And to reach that 100 million, we have to call on private sector to step up. We have so many private sector organizations like the coffee associations, we have tea manufacturers and tea farmer associations, we have maize growers associations, for example. In West Africa, we have the cocoa associations, and those farmers still need sanitation, and those are the same farmers we are targeting also with this reaching 100 million. A good example of a private sector partnership that we've had in Nigeria is with Indorama. It's a fertilizer manufacturing company working with farmers. We've managed to upgrade toilets for 25,000 farmers within that partnership. And that is a very, very good example of how the private sector can actually step up and address the issue of sanitation and hygiene in Africa. Beyond Africa, we're also working with Twinings, which is a tea manufacturer as well, based out of the UK, to support farmers in India to upgrade their toilets and sanitation and hygiene in their fields. And the call to action for private sector partners is that we know and we understand that there's a corporate social responsibility that most of them drive and work on. I know the targets may be different, but if you look at Africa, then after malaria, diarrheal diseases is number 2. Causes of morbidity. If you upgrade one toilet, you impact 5 to 7 people in that home. The 5 to 7 people in that home will not suffer from diarrheal diseases. 5 to 7 people will have clean toilets to go to. So you can see that the impact is easily measurable, and you can actually help us achieve that 100 million, which contributes towards achieving the Sustainable Development Goal number 6.